Shoulder impingement causes pain on moving the arm out to the side of the body or overhead. So in this video, I'll provide some exercises to help treat this common condition. Hi everyone, and welcome to Exercise for Health. I'm Richard, and today I have exercise advice if you're suffering with a shoulder impingement. If you're new to this channel, we offer tips, advice and exercises each week to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. Shoulder impingement syndrome, also known as subacromial impingement syndrome, occurs when the tendon of the supraspinatus, one of the four rotator cuff muscles, or the long head tendon of the biceps brachii muscle, presses and rubs against the acromion bone in the shoulder. It's the most common cause of shoulder pain and can lead to inflammation, fraying of the muscle tendons, causing a potential tear, and a weakness with shoulder movement. But it can also feel uncomfortable when lying on the side of the affected shoulder. Poor posture is one of the leading causes, but it can also develop as part of a muscle imbalance in the shoulder girdle, overuse from intense or repetitive activities involving the shoulder, such as painting, throwing sports, tennis or swimming, and it can also be affected by age-related conditions such as bony spurs that can decrease the amount of space in the shoulder joint. It can become a vicious cycle as the swelling of the tendon reduces the space in the shoulder, which compresses the tendon even more, resulting in further microtrauma, causing more swelling and inflammation and so on. Therefore, the initial treatment should include stopping what might be causing it to allow the tendon to begin to heal. This shouldn't mean stopping or restricting movement altogether, but just temporarily ceasing the activities that are aggravating the issue. Some medical practitioners will advocate regular ice treatment to reduce the inflammation. Some will recommend anti-inflammatory medications, steroid injections, or even decompression surgery, depending on the severity of the condition. However, most agree that some form of physical therapy and gentle exercises to increase the subacromial space in the shoulder and correct poor posture will help reduce the pain symptoms and bring back functional strength to the shoulder again. I would suggest for people to seek the advice of a qualified physical therapist who can assess their shoulder symptoms to ensure that it is an impingement and not something else such as arthritis, bursitis or a frozen shoulder. However, as part of a treatment plan over a few weeks or months, the following exercises may help bring some relief to a diagnosed shoulder impingement and begin to increase the capacity for the shoulder to be able to do more. The first two exercises can be done if you are experiencing a lot of pain and can't move the elbow away from the body too far without feeling discomfort. Firstly, pendulums will help free up some space and begin to mobilise the shoulder joint. You can do this with just the weight of your arm, or you can hold a water bottle or a small hand weight to add to the effect. Make sure that you support your upper body with the other arm, with a slight lean forward, but gently swing your hips around, keeping the free arm relaxed so it starts to gently swing around. Do 10 rotations each way, and this one can be done every day. The second one in this acute phase will begin to strengthen the rotator cuff muscle group of the shoulder so the capacity for load can be improved. It will also help promote a healthy blood supply to the affected tendons to speed up the healing process. Using a resistance or therapy band, keep a short rolled up towel wedged into your waist with your elbow and then pull the fist outwards against the resistance, maintaining a 90-degree bend of the elbow at all times. Keep your shoulder blades down and pinch back together and only go out as far as you can without causing any additional pain before slowly returning to the start. If you don't have a band, you can do this lying on one side with a bottle of water in your hand. Repeat this movement about 10 to 15 times for 2 or 3 sets with a minute rest between each one, and it can be done 3 or 4 times a week. The next two exercises are for when you begin to see some improvement, but you still experience pain with the arm above shoulder height. Although this first one seems counterintuitive, hanging can be a really great way to free up some space in the shoulder. You will need something to hold onto above your head that can support your body weight, like a pull-up bar, but essentially with your hands a shoulder's width and facing forwards, gently lower your body with the support of your legs until the arms are fully stretched out above your head, and hold this hanging position for between 5 and 30 seconds, depending on what you can tolerate. You can do this 2 or 3 times with a short rest in between, and gradually start to allow more of your weight through your arms by reducing the support of your legs. To strengthen the muscles around the shoulder, ATY lifts can promote shoulder strength for the rotator cuff muscles, as well as improve posture. Starting with the A lift on your front face down with your arms to the side of your body, palms facing your hips and shoulders down away from the ears. Keep your arms straight and then lift them up away from the floor as high as you can and hold for 2 to 3 seconds before lowering back down. Repeat this movement 10 times. You can then move on to the T lift, which is the same, but with the arms straight out to the side with the palms facing the floor. And again, repeat slowly 10 times with short holds at the top of the movement and squeezing the shoulder blades together. The final Y lift is with your arms above your head, palms facing each other, allowing the shoulders to lift up towards your ears to generate an increased range of movement. Again, do this 10 times, and by the end of the 3 movements, the muscles around your shoulders will be telling you that they've worked hard. The final 2 exercises will help if you are nearing the end of your recovery and have a good range of movement with occasional pain symptoms. To mobilise the shoulder and maintain the free space, working on good full range shoulder mobility will help. Ideally, it would be better if you have a therapy or resistance band to allow for an increase and decrease in its length during the movement, but you could use a very long rolled up towel and try to maintain tension in it. Begin with your hands about 1.5 to 2 shoulder widths wide on the band or towel. Keeping your arms straight, take the band overhead behind you, allowing free motion of the shoulder joint and shoulder blades throughout the movement. Once the band has touched your bottom, reverse the movement back until the band is in front of you again. You can increase the intensity of this movement by starting with your hands closer together on the band, but perform 10 movements each way to really mobilise the shoulder. The final exercise to strengthen the shoulder in a good range of movement is the straight arm pullover. If you use a foam roller underneath your thoracic spine while lying on your back, it will also help improve your posture while strengthening the muscles around the shoulder. With a dumbbell or alternative weight in your hand and keeping the arm straight, allow it to move overhead behind you with the thumb leading towards the ground. Ensure you reach a good stretch at the bottom before bringing the arm back up to the start. With this movement, let the shoulder blade lift up and your thoracic spine to extend, but engage your core muscles so that the lumbar spine in the lower back doesn't move at the end range. This will ensure all the movement is in the shoulder and the upper back, but not in the lower back. See if you can perform 2 or 3 sets of 10 with a weight that challenges you a bit by the last 2 reps. I hope the information and exercises in this video have helped you today. If so, please give it a like by clicking the thumbs up button below to help this channel grow so more people can benefit from it. Thank you so much for watching, and remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.